So what are the costs involved in private healthcare? There is the cost of the consultation itself, the cost of any tests, and the cost of procedures. My fees for a new consultation are £250 and for follow-up consultation are £150. Tests are charged separately by the hospital in which you're having the test done, and the prices do vary from hospital to hospital. Fees are payable for procedures such as an electrocardiogram, also known as an ECG. Other common tests include radiology tests such as X-rays, CT scans, blood tests, and cardiac physiology tests such as an echocardiogram, which is an ultrasound scan of the heart, also ECG monitoring tests, exercise tests, and so on. Fees for treatments or procedures also have three components to them. There's the fee for the surgeon, a fee for the anaesthetist, and the hospital fee itself. The hospital fee comprises the charge for the use of facilities and the hospital staff, as well as any devices that may be required, such as a pacemaker or catheter ablation equipment, for example. If you're a self-pay patient, these fees are usually set up as a single package, which you'll be informed of before undergoing the procedure. For insured patients, these are invoiced separately by myself, the anaesthetist, and the hospital directly to the insurance companies. So how does insurance work? Well, you will normally contact your insurer before arranging an appointment to see me. They will issue you with a pre-authorization code and will tell you what that code covers. Usually that will cover an initial consultation, a follow-up, and some tests. Usually blood tests, ECGs, X-rays, and cardiology tests such as echocardiograms, exercise ECGs, and prolonged ECG monitoring. If further tests such as a cardiac CT or MRI are required, you'll usually need to contact your insurer again to make sure that this is covered. If a procedure is required, I'll tell you what the code of that procedure is, and this will need to be authorised with your insurer. For Bupa, there are specific forms that need to be completed for patients undergoing ablation procedures or complex pacemakers or defibrillators, and I will undertake that for you. I will invoice the insurance company directly for consultation fees and any procedures that you might have. The hospital will also invoice the insurance company for any tests or their fees for any procedures. If you have an insurance excess, the insurer will tell us what this is, and we will then contact you to collect the excess directly. If you're paying for your own treatment, the costs will be sent to you in writing before any consultations and also before any tests or procedures are performed. Some hospitals do a self-pay package price, which is a guaranteed price that covers all the fees involved, hospital fees, anaesthetic fees, and consultant fees, as well as the cost of devices, etc. These will all be laid out in detail with you, and we can consider that together before you proceed. I do hope you found that overview helpful. Please do reach out if you want to make an appointment to see me, or if you have any questions about fees or other things.